understanding and reducing our rate of maternal mortality. CDC recently announced it's funding the first round. It is funding the first round of grants to support 25 states, their efforts to combat maternal mortality through the creation of maternal mortality review committees. As states prepare their implementation efforts, what should this committee be paying the most attention to?
Well, I think it's wonderful that the CDC is now sponsoring 25 perinatal quality collaboratives. I think the data is a key point. I also want to say one thing, though. You're absolutely right. What we don't understand, we can't really address. But there are models of success. We've heard a lot about Parkland today. If we look at California Collaborative and what they've done by using maternal mortality review committees, gathering the information around deaths, then using that information to drive quality improvement, and they've done a number of the bundles, the same bundles we're talking about for AIM. They started hemorrhage, hypertension, venous thromboembolic disease, and they've actually lowered deaths in hospitals that adopted these bundles by like 21% for the hemorrhage-related deaths. And their maternal mortality rate, while the rest of the United States has been going up, theirs has been going down. So we have evidence that when we tie data to quality improvement, we can really make a difference. The important lesson about California, though, is an additionally important lesson is that their disparities, however, did not decrease. So they lowered maternal mortality for white women, they lowered it for black women, but that gap is still there. And now they're trying to target a lot of the things that the rest of us are trying to target around health equity, combining quality improvement, what the data tells us, with cultural humility, and sort of trying to understand communities, getting them involved to help tackle this problem, which is something that the AIM bundle also tries to do, that ACOG partners with community organizations to get their input about how best we implement these bundles in not only hospitals and health systems, but we get communities on board as well.
Thank you. Are there concerns within the research community regarding the integrity of the data being collected in states? And if so, where are those concerns and how might they be addressed? Are there any concerns with regard to the integrity of the data?
Well, there's certainly concerns with the use of what I had mentioned about if you only base maternal mortality rates on vital statistics data only, that you're only getting a slice of the picture, and it's not a great way of monitoring our trends across the nation. And the CDC now uses vital stats. It combines it with state discharge abstract data, which gives a better estimate. But still, the best estimates are the data from the maternal mortality review committees that actually get multiple sources of data to figure out how this death occurred, what were the contributing causes, and then feeding that back up to the CDC through their Maria program is probably the best way for us to get data on this that we can use for improvement.
Very good, thank you. Last week, the CDC released a report titled Racial Ethnic Disparity in Pregnancy-Related Deaths. In the report, CDC suggested that steps still need to be taken in order to better integrate care delivery between hospital and pre- and post-care services for mothers and their newborns, as well as better management of high-risk patients. How might this committee consider addressing these specific challenges highlighted by the report? And can you highlight any states or entities that can be looked at as models? Again, best practices in these areas.
So I think that I would echo much of what Dr. Howell just mentioned. I think is reflective in that effort. California has been a model for a lot of the programs, but the same principles are true within the AIM domain. Parkland Hospital publishes Williams Obstetrics as a textbook. It's the most popular textbook worldwide. We have 17 authors on our faculty, including myself. And these principles are the same. The important part of this is disseminating that level of scholarship and information to the community centers, to the communities at large, and the providers in those communities.
Well, thank you very much, and I'll yield back, Madam Chair. Thank you.
The gentleman